Mr. President, I did come here, though, today to rise and talk about the need that Virginians, and for that matter, Americans have, about a health care system that's affordable and accessible and provides high-quality care. I voted for the Affordable Care Act back in 2010. And I've acknowledged, I think along with many of us, that just like every major reform, just like Medicare and Social Security and Medicaid all before, Congress never gets 100% right the first time. And that Congress needed to revisit and improve certain aspects of the ACA. Of course, as any legislative body, anybody who serves in the legislative body knows, you got to have a partners in order to get to yes. And unfortunately, that's what we've heard from folks on the other side for the last seven years. We've heard all the critiques, we've heard the screech of repeal, but we've not heard any kind of plan on what you replace. The fact is, like it or not, ACA has played a critical role in driving healthcare innovation, protecting consumers, and reducing overall healthcare spending. And those are just facts, not alternative facts, not alt facts, those are just facts. And the increased coverage to more people now makes it all the more difficult to find some way to repeal and maintain all the things that people like, yet replace it with a plan that actually is more cost effective. So today we consider a candidate for the Secretary of Health and Human Services, the lead cabinet member who will oversee our critical health care programs. Congressman Price has advocated for dismantling the ACA and made it clear that as Secretary of HHS, he would seek to implement policies that I believe will make health care more expensive and less accessible to Virginians. Today, after a great deal of reflection, I join my colleagues in opposing Congressman Price's nomination to be Secretary of HHS. And rather than going through the statistics and facts, and I know I've got other colleagues that want to speak, I want to just reflect briefly on a couple of stories I've heard from Virginians. One of the things that was a benefit that I don't think folks have focused on enough on the ACA is that ACA, with all its challenges, did allow people freedom from the trap of being caught in a dead-end job that you couldn't move from because your fear of losing your health care benefits. This was the first move towards moving towards a portable benefit system, something I think that we're going to have to move beyond health care, but to retirement and other aspects as well, as more and more workers work not in traditional full-time, long-term employment, but more and more, a third of the workforce today already is in some form of contingent work, part-time work, independent contractors, gig work, and they have no benefits other than the fact that through ACA, they were able to maintain health care. The ACA has actually reduced this phenomenon of job lock. A couple of weeks ago, I met Andrea in Richmond. She'd always dreamed of opening a software business, but both she and her business partner were considered uninsurable because of pre-existing conditions. But the ACA changed everything. And after obtaining insurance through the exchanges, Andrea and her business partner were able to take that risk. Today, that successful company has a staff of 12. As Andrea said, quote, "Simply put, my business would not exist without the security of the Affordable Care Act." The coverage gains we have seen are remarkable. That's clear from hundreds of Virginians who've contacted me with stories like Andrea's. In fact, never before in our nation's history has the rate of uninsured dropped below 10%. In Virginia, a state where our legislature unfortunately wouldn't expand Medicaid, we've still seen an uninsured rate drop from 13% to 9%. And 327,000 Virginians got additional coverage. This is especially true in rural areas. Nationwide, the ACA has lowered the percentage of uninsured by 8 points in rural communities that often struggle with hospitals that without ACA would be on the brink of financial extinction. Here's another quick example, this one from Janet Mosley from a rural area again south of Richmond, who grows and sells organic vegetables to support her family, which includes 4 children. She said, quote, "We went through various attempts to manage the cost of health insurance and health care and our finances before the ACA. with no good results. Because of the ACA, we have been able to have an appropriate plan with a realistic deductible, access to quality doctors, and be able to go to preventive care annual appointments. We are quite fearful about what life and business may become without the ACA. ACA repeal would be disastrous. Unfortunately, though, not only has Congressman Price strongly opposed the ACA, but his plan, or what framework of a plan we've seen, and other proposals dramatically scale back the individual market reforms that allow people like Andrea and Janet to obtain meaningful coverage. As our workforce becomes more mobile than ever, Congressman Price has said people should have access to care, but access to care without affordable care isn't true access. For example, if you got rid of ACA with no plan to replace it, we'd see the reinstatement of lifetime and annual limits on coverage. Those limits are what turned getting sick into a financial calamity for so many people. Plans would be required to cover far less in terms of conditions, moving away from ACA's promise that insurance is worth more than the paper it's written on. And, as I mentioned already, the close to a third of the workforce that is already in some level of non-traditional work who don't work full-time in a long-term employment facility would lose that flexibility to move from job to job. We've also heard from Congressman Price plans to block grant, for example, Medicaid. We in Virginia have a very, very trim Medicaid program. We've also not expanded Medicaid, which I think was a grave mistake of the legislature. The governor and I agreed we should expand. Putting a block grant program in place for Virginia would be a disaster in terms of Medicaid. As well, Congressman Price has voted against the Child Health Insurance Program, the CHIP program, one of the things that I was proud to expand in Virginia and where we ended up signing up 98% of all eligible children. Congressman Price called the CHIP program, quote, government-run socialized medicine. What he didn't say is what he'd say to the 200,000 plus kids in Virginia who get their health care coverage through CHIP. So I believe that Congressman Price's approach, whether it's on Medicaid block granting, whether it's on ACA, whether it's on the CHIP program, whether it's his failure to come up with a sufficient plan that provides access and affordability, all mean that if we go forward with his nomination, the kind of chaos that would be created if you repeal ACA without a replacement plan in place, it will not only affect the 20 million plus Americans who've got health care coverage through the ACA, but literally everyone else, because it will absolutely pull the bottom out of the overall insurance market. These are chances that we can't take.